Thank you all for being here. Today's conversation is part of our Accounting Alchemy Network's ongoing discussion series on how to fund common resources in alternative ways. And lately, we've been talking about how we can fund healthcare, especially with today's skyrocketing insurance rates. And in our research, we discovered a nonprofit called Manifest Equity. And Manifest Equity's mission is to make wellness accessible to equity-seeking people and allies. And I'm so excited today to have their board chair with us today, Doc Jana. And they're going to talk to us today about the work Manifest Equity has been doing and how individuals and organizations can have affordable healthcare in the United States. Yay! So thank you. Welcome, Doc Jana, and thank you for being here. Please tell us about Manifest Equity and everything you guys have been doing.
Amazing. Thank you so much for having me. I'm excited to be here. Yes, Manifest Equity is a nonprofit founded in Richmond, Virginia, and founded in 2024. And that wellness mission of ours, making wellness accessible to equity-seeking people and allies, is broad, and it's intentionally broad because wellness is one of the fastest growing industries in the country. And as we grapple with times that are very difficult, some of the most vulnerable people are equity seeking people. And I come out of many, many years of DEI. I ran a DEI corporation, the first and oldest one and largest one in Richmond, Virginia, for like 23 years. And when those things closed, I went for the nonprofit model because wellness is what we were always after. We just want everyone to be well, particularly in the workplace. And so I'm bringing, as the founder and board chair, a deep legacy, a multi-generational legacy of deep community care and community involvement. I also come from a very medical family, so the fact that this has expanded to include actual healthcare is really exciting to me. And the first thing that I'll say is that, Manifest Equity did not come up with the underlying medical models. What we've done is we've come together with other people who are doing innovative things. We do see ourselves as part of the healthcare revolution, the inevitable one that is necessary. And so we have taken an aggregate of different products and white labeled them. I actually got my first Virginia life, health, and annuities license in my early 20s. And so I'm like coming back full circle again and looking at that. And I will show you, I'm going to take you to the website and show you a little bit about how we are doing what we're doing here. Let's see, is that the right one? No, that's not the window I'm looking for. Please bear with me for one moment. I should have picked that ahead of time. There we are. I think we are correct. Back here. Yes. Okay. So I'm going to go through the whole thing. That will make it easier. Okay. Here we go. So this is manifestequity.org is the website here that you can go to. And we are building a thriving world where everyone is enough and has enough. We believe that wellness is a human right. Healthcare is a human right. So we do see ourselves as part of this healthcare revolution. And I'm going to show you just how affordable our affordable healthcare is. And our goal here, because it is so accessible, like our plans start at $2 a day, and $2 a day is unbelievable. But what about $1 a day? What about 50 cents a day? What about $0 a day for people who genuinely cannot afford it? So I'm working on building a $10 million endowment to start to subsidize this and make it available for people who can't afford it. And that will eventually be a multi-billion-dollar endowment because there are, in fact, billionaires, and I'm looking at you, since we'll be sharing this far and wide, who recognize that there's a problem, and it's not, it's not a rocket science situation. It is a math problem. We just literally need to fund it. And so that's what we're looking to do here. So when you go to the website, you just click on find a healthcare plan. And here are the big overviews. We're just going to go to explore individual and family plans is going to get us to the healthcare page. So we've got the first thing that I'm going to talk about here are not actually insurance, like major medical plans, okay? Because the people who put this all together, the first thing that they said was, we want to get healthcare to people. We want to get people access to healthcare. Major medical is something that we offer, so we are going to look at that and we are going to talk about that. But the first thing is making sure that people have coverage. There are lots and lots of people in this country, millions of folks who don't have coverage or adequate coverage at all. So when I tell you about the $2 a day plan, I'm talking about this base right here in the middle, $59.95 a month, the base plan. This base plan, the shortest way for me to describe it is like direct primary care, which is a membership model. I actually have a direct primary care doctor that I pay less than $100 a month, right? So you can, it's anywhere between like $60 a month to $100 a month on average. And I go there, that's all I pay, is I pay my less than $100 a month for direct primary care. And this is not what I'm selling. I'm telling you what the hybrid is. Direct primary care is a membership model where you don't pay anything extra. You just pay. If you don't know what that is, look up direct primary care in your city. It is brilliant. And if you can get into one, it's a great thing to have. I get nothing for telling you that. That's why we're a nonprofit, because we shouldn't be profiting off people's illness. That's another story. The second part of the hybrid is telehealth, which we learned in the pandemic. We can actually get a lot done by telehealth. An incredible amount done. So your telehealth is the second part of the hybrid, and the third part of the hybrid is concierge care. So as a serial entrepreneur who has founded, I think, 6 companies at this point, in various seasons of my life, I paid many thousands of dollars for concierge care, just to have access to pay money to doctors that I could text when I needed something. When I forgot my inhaler and I was skiing in the Alps, I could have my things shipped over to me. Is absolutely unbelievable. This $60 a month plan is a hybrid of those things. And that's absolutely incredible. So what you're going to get is a virtual primary care clinic. So your telehealth is not just, it's not lightweight. You have an actual PCP. You have a registered nurse. You have a physician's assistant. You have a care team that is following your actual care and providing you with whatever it is that you share with them. They're going to give you input on that. If you don't want to tell them anything, then they can only treat you for what you're willing to tell them. But if you're willing to share with them, they can help diagnose, they can treat. They can get specialists. Like if you've got a little something, little skin tag hanging on your face and you need a dermatologist to see it, for $0 copay, you can see your PCP. You can make appointments with your PCP. You can get specialists. We have thousands of medications that are generic on $0 copay for the medications. We also have thousands that are on discount plans, and we can show you links for all of that so you can see what's in there. But it's absolutely incredible. They also help you navigate and manage chronic care. So I have chronic conditions. They help do chronic care management. And my favorite part of this base plan is the healthcare navigation. How many times have you been in the doctor's office and they've been telling you something about something that you have, and you've had no idea what they're talking about or what to ask, and then you go home and you have 15 questions. We can literally put a medical doctor in your pocket who will come with you to the appointment and ask the questions you don't know to ask in 80 different languages. $60 a month. We're still on $60 a month, okay? They will help advocate for your billing. How many times have you had a billing situation that you didn't understand, or get a diagnostic that you didn't actually need? Because unethically and unfortunately, people are putting folks through diagnostic procedures and tests that they don't actually need. So anyway, they can navigate your medical billing with you, for you, and make sure that you're not being overcharged. They can do things like dental second opinion. So you can upload your results, your different things. And if they say you need to have XYZ procedure, you can have your other primary care digitally look at that and make an assessment for you. So it's absolutely incredible, sort of what they can do, how they can support you. Regardless of whether you buy major medical insurance from us or you have it from your spouse or somewhere else, they can look at what you have and they can tell you whether or not you should use your insurance for a given procedure. So I had to go to a rheumatologist and I needed to have like 15 different diagnostic things done. And they looked at my situation and they were like, yeah, don't use your insurance. We're going to give you this discount program and you're going to pay $59 and get all 15 diagnostics done, because they have access to things that we don't know about. They also know when direct pay is a better option, because a lot of people don't know that the direct pay fee versus the insurance fee are wildly different. And we think that because we have insurance, we have to use it. They prefer to bill your insurance because they get a lot more money. But if you say, I want to direct pay, and you know when to do that, you can save yourself so much money. So that's Step one, that's the base plan, $59.95 a month, and it's $89.95 a month if you have a family, and a family is two adults living in the same household and up to 8 children. All of these benefits would confer to all these people. And with that plan, you also have there's a dental embedded, dental discounts, vision discounts, and because this is not already enough, zero copay therapy. So you can talk to a mental health professional, and we're talking licensed clinical social workers. We're talking psychiatric RNs who can prescribe. All of the doctors on the other plan that I told you about, that the other part of it can prescribe. So you can get psychiatric meds as well. They actually are 24 hours a day for all of these services. So if you have something, you have an accident in the middle of the night, you can call and you will get a response immediately. They have 24-hour emergency triage. Sometimes you just need somebody to tell you, hey, you need to clean that off, get some Neosporin, put a Band-Aid on it and put some ice and go to sleep in the morning. Or hey, that looks a little deep. You probably want to actually go to an urgent care. So just having that can save you so much trouble, so much money. And then again, the telehealth, and these are available in all 50 states. We are one of the I think 2 or 3 brokers in the country that can sell all of our plans across all 50 states, and it's so exciting. All right, next up. So this is all virtual.
Doc Jana,
go ahead. Yeah.
You were saying too that these are time sensitive, like for the pricing and stuff, or I don't know. You were telling me something about time sensitivity. Wanted to mention that.
So the time sensitivity on it is yeah. So I think the thing I was saying is I'm going to show you these plans, and the plans that are here now. If you can see it, you can buy it, you can have it. We will service it. But this is a work in progress, and we are always adding things. So we're looking right now at creating a digital nomad plan, something for van lifers and something for, people who are traveling all over the world, right? So that doesn't exist yet, but when it does exist, you can add it whenever you want. And I do want to say that that's right. The time sensitive thing is, we're recording this. I don't know if you're here with me live today or if you're watching it in the future. And if you're watching it in the future, if you go to the manifestequity.org website, the plans might look different, and that's okay, right? Because the plans will expand, and you can always book a call with us and find out details about more. Okay. So the base plan, again, that's the starting place. We want everybody to have that, because the healthcare navigation by itself, like if you have the location services on this app and you roll into a hospital emergency room, you'll get a note, you'll get a call from one of our folks, you'll get a ping that says, hey, we can tell you're at an emergency room. Do you need help? Do you need us to come in with you? Do you need anything? Right? It's absolutely incredible. So this is all virtual. So what happens when you do actually need to go to urgent care? What happens when you have to go to the hospital? So we actually do have, there's a long list of diagnostics and labs that are included and covered to varying degrees, from 0 to, various percentages. And so if you need to get like blood work or something like that, we'll send you, we'll use that program, use the discounts, use whatever insurance you have, and get you to wherever you need to get the diagnostics. And then the virtual PCP will navigate that for you and tell you what you need to know from there. And it does cover things like, we do have coverage for things like annuals and mammograms and colonoscopies. A lot of the wellness stuff is included in that. But then what happens if you, like, for real, gotta go to the hospital? Like, you got kids, Johnny fell out the tree and broke something. This is when we have these other add-ons. So accident insurance, I always recommend for folks who have kids, or if you know that you're accident prone, you tend to go to the hospital multiple times a year. This is a really good one. So the accident insurance is like, it's kind of like insuring your whole body. You think, how the pianist will insure their hands because that's their money-making part? Well, this is like having insurance for your whole body. And we should call it incident insurance, because it doesn't have to be an accident. You just need to have an incident that takes place, and you have to go and get x-rays, MRIs, you've got, fractures, dislocations, ambulance. There's also like you actually have to go into the hospital. So there's a first day in the hospital and then every subsequent day. And this pays out. You can have it paid directly to the provider, but it also typically pays out to you, and then you decide what to do with it. right? And so if you go through and you look at the plan details, if you click on that, it'll give you a list of like every part of the body and all kinds of different things that can happen. And it'll tell you it's going to pay you $6,000 if if you dislocate your hip, for instance. Okay. And so we add that in, and it just helps create a little more security. The hospital indemnity, and these are all individual. They're not building on each other. They're three different things. We just recommend, and I think it says right here, every program starts with base, because that's the place that you should start, because it gives you the pieces clicked together much better. The hospital indemnity is, again, it's like the accident, but it's designed specifically for bigger catastrophic events. You have to go to the hospital and you're going to stay there for several days. You've got to have some kind of surgical procedure, etc. So it pays out more. It's a little bit higher per month, but it is absolutely worth having if you're looking to have a base coverage plus the indemnity plans. These are all guaranteed issues. So if you've got pre-existing conditions, et cetera, you're guaranteed to get these plans, and they will pay out for those different things. So this is the non-insurance products. This is just healthcare coverage. I know that there is a separate dental, like full dental insurance and full vision insurance coming. Right now, the base has vision and dental included as discount plans. But by the time some folks see this, I think that we'll have the vision and the dental insurance covered as well, and those prices will be very, very agreeable. Now, these are the full health plans.
Dr. Jana, can I ask a quick question before you move on?
Mm-hmm.
Can you scroll back up just a little?
Mm-hmm.
And maybe you answered this, but it says, just go up a little bit more. It says in that bottom center of the box, base is not medical insurance. So what's the difference between medical care? I think this is what it sounds like, and insurance.
Yeah. So major medical insurance is what we all know to be insurance. So your Aetna, your Cigna, your Blue Cross, your Blue Shield, the stuff that you get when you work full time at a company, and either they pay for all of it or they pay for part of it. That the system that we're accustomed to is the major medical insurance system with the ginormous premiums. And then we have the we have the ACA, right? And that has, slightly less ginormous premiums, but it's still major medical insurance. That's what we're going to talk about here. These are health plans because they're not major medical insurance. It's a completely separate set of systems where providers in the case of the base, you actually have providers who the company who creates the virtual primary care is just a company that has hired hundreds of W-2 doctors, hundreds of W-2 therapists. Like, how can I give you unlimited free therapy when you're paying $60 a month? Well, it's because we have hundreds of W-2 therapists who get a salary. They're not getting paid by the hour. They're not seeing anybody in person. They're only doing virtual. Same with the clinic. The clinics are in Colorado. It's only virtual. They don't see people in person. And so with everything that you see about our models, including the major medical, we've taken, like, the reason that your major medical is so freaking expensive is because there's like 10, 12, 15 middlemen between your premium that you pay and the service that you actually receive, which is why it's so expensive when you go through your insurance versus infinitely cheaper when you do direct pay, because they don't have to pay all these people. And so what we've done with these services is one, like the accident insurance and the hospital indemnity, those are indemnity plans. That's like life insurance, right? That's like a term insurance, right? It's a catastrophic insurance policy, but it's not major medical. Those are insurance, but they're not major medical. The thing in the middle is a set of services provided by a set of providers that have chosen to break the model and do it differently. My direct primary care doctor, who is a full MD in Richmond, Virginia, does not take major medical because she runs a direct primary care. She takes it's now $89 a month, and she sees you for all of your wellness, all of your sick. She can do telehealth, right? So there are enough people that see that there are problems with, like, have you ever had a doctor or a therapist who won't take insurance? They're like, I'll give you a super bill. You can deal with it. I don't even want to deal with them. That's increasingly common. People don't want to be bothered. So it's not major medical because it's not Aetna. Now that The inside of the base, currently the discount program that exists inside base right now does use Aetna for dental. But other than that, it is directly with Amaze. Amaze Health is the organization that does the clinic. And that's all they do is this virtual care model, and they're intentionally breaking the system and providing people with better service than they're used to. Yeah. All right. Next up, major medical. Our major medical, you can see right here, starts at $269 a month. And I always like to give a moment of silence for a $269 a month premium. Alina, we were talking about the 1980s. Those are some 1980s major medical prices, ladies and gentlemen. So yes, this is absolutely incredible. And we actually, by the time folks see this, there will be a second kind of gold level MVP plan. And what I want to say about the MVP, and I'll show you, there's also a platinum down here as well. And that's $799 a month. But I'm going to start with this MVP plan because from the MVP up, everything is guaranteed issue. Okay. It doesn't matter what your pre-existing conditions are. This is what you have. Now, I have pre-existing conditions. I will tell you that I have the base plan, the accident plan, and the MVP. That's my super stack because let's see if I can see the plan details here. Let's do this. Let's see what that does it show me. Oh yeah. Okay. So they don't, where's the, oh, they don't have the thing. Oh, they've changed. And this is a case in point on the website will change and the plans will change. It's different now than it used to be. So what I was going to show you is that, well, it's right there. So the deductible. So you see this deductible on the MVP is really high. It's $5,000. Deductibles for anybody who's dealt with them, which is many of us, they're not that bad when you nickel and dime it across the whole year and you just have small things that happen. But if, like me, you end up, going to the doctor because you're in pain one day and they schedule you for emergency surgery a few weeks later, and that surgery is $250,000 and you owe your whole deductible at once, most Americans are no longer sitting on tens of thousands of dollars that they can spend on one procedure. And so the wonderful thing about the stack that I have and the way that we do this is these folks don't care who pays your deductible. If you have an accident plan or a hospital plan and you have to go and get surgery, they're going to pay out on that deductible, and you'll end up with just your copay. You'll end up, max out of pocket on this one is $9,000. So it's a great idea to have the add-ons for the catastrophic purpose and also to work on bringing down that deductible. Okay. This one also has an HSA plan here. And the HSA, if anybody hasn't had a health savings account, it's absolutely incredible. That is pre-tax money that goes in. And like I'm a certified sound healer, and I have sound bowls, and I went to buy some new ones. And the first thing that came up on the web page for Rainbow Sounds was, you can use your HSA card to buy your sound bowls. The broad definition of what counts as something that you can legitimately write off as a health expense. Like I can pretty much I can make anything. This is good for my health. And we're not really super policing that, like we're leaving that to you. You can put in, I think, a max of like $4,500 a year or something into that. And you can let that accumulate for, 4, 5, 6, 10 years if you want to. And that's all pre-tax money that you can spend on all the things that make you well. Okay. Love that. And this is the MVP plan is something called an open network. And so it actually uses, I think it actually, last time I checked, it still used Cigna and PHCS. All these plans are Cigna and PHCS. PHCS is one of the oldest and largest healthcare provider companies in the world, physicians networks in the country. And it is, they have, I think, over 800,000 providers in the country. And then Cigna has like 1.2 million. And so together you have access to both. And it's just a matter of, it's PPO. So you can choose your folks. You don't need referrals. You've got over 2 million folks within the network. And if you have a person that you love, a doctor that you love, you can absolutely have them join either of these networks as long as they take insurance. It's a free form. It takes 10 minutes and they can be onboarded into the network in no time, like less than a week. It's pretty quick. All right. So as you go up in these plans, your you see the deductibles go down, and so does the max out of pocket, all the way until you get to, the platinum plan, which has no deductible, and that's just unheard of. Max out of pocket for an individual is $1,250, which is bonkers. Okay. These particular plans, these three, the silver, the gold, and the platinum, they actually have limitations currently. We're working on that. I don't love it, but basically you have to be pretty healthy. You have to be able to get through an 11-point health attestation before you can get into those plans. And if you can get through them, then you can access them. So if you're relatively healthy and you've got $800 a month to spend, by all means do it. Otherwise, our MVP plans are guaranteed issue. Like I said, there's a new one coming online March 1st, and then all of these are guaranteed issue as well. I want to show you I want to see if I can get to the family level. They've changed the things on me. Oh, there it is. Here we go. Individual. So individual plus spouse is $499 on the MVP. Individual plus children is $509 on the MVP. And then family is $679 on the MVP. Like, that's amazing. I'm talking to people right now who are paying $2,000, $3,000, $4,000, and $5,000 a month to cover their families. This is the biggest expense in many households behind mortgages. Go ahead, Jana.
Jana,
Jana.
I noticed none of these things ask how old you are.
No, they're not age banded at all. Thank you for pointing it out. I forget because I'm like, I don't have enough history with healthcare back in the day to have that experience. But yes, we don't age band. Go ahead, Alina.
Yeah, I also wanted to add something that I heard from another presentation from your team. You can confirm or deny this. They were saying that it's something, how many children are covered under the
8?
8, yeah. And then I think you were also saying that the family doesn't necessarily need to be blood family, like if it's people living with you.
Yeah. That's the case on, I'm not sure if that goes off, that applies to the major medical. I know that applies to the base plan. So the base plan is the one that, to me, like this is usual suspects. To me, these three are the ones that we struggle with, right? Because they're high. Now, even though these are high prices and these are names that we've still negotiated. You're not going to find these rates anywhere else. It's better than what's on the exchange. We typically come at about on average 30% less than what you can find on the exchange. And so it's better, but it's still really high. And so I know that with the base plan, if they're living in the house, just kind of depends on what's going on there. I'm not sure with the major medical, but you can always let us know. Like, we consider the people who purchase our plans, like, you're joining a family that is based on, a handful of founders who had their own, just gnarly experiences with healthcare and decided that there had to absolutely be a better way, that we could do this better. And so, let me see if I can find the attestation for you. The way that we used to do it was, I probably need to go into my cart. Let's see, I've got you guys. I have you all sitting up here. Where is the cart? Is it down here? Enroll now. That one's locked because I must have something in my cart. Show me where my cart is, y'all. So the way that we used to do it was you go into the cart and it would show you this 11-point attestation. And I apologize because the website has changed. Go ahead, Cassie. I'll look for it while you ask the question. Go ahead, love.
Thank you. Yeah, I guess I'm thinking through, like, I live in a community house and I live up in the mountains of Colorado, and we're all snowboarding and skateboarding and riding bikes and doing dangerous stuff. And would my whole household count as a family?
Potentially, yes. Yeah, so I'd have to ask. I can put you in touch with the right people to ask. It just depends on which plan you're looking at.
I guess I was specifically looking at probably the
But if they're
accident for the
it's
hospital.
adults is only two
Right.
adults and up to 8 children.
Okay,
So
got you.
yeah,
Okay,
so
two adults
not if
then.
it exceeds that number of adults.
Okay, gotcha.
So if
All
you've
right.
got two people who are domestic partners, we're not worried about, like that's fine. Yeah, like
Yeah,
I'm non-binary. That's how we roll.
yeah,
That's
yeah.
fine. And they don't
Okay.
have to be, you don't have to be married. They can be partners. That's fine.
Yeah.
You just but yeah, if they were children that were like in your care, in your custody, so even if
Hmm.
they were, adopted or what, if they're living in your house and they're in your custody, they would count as children for you. Here we go. Here's the attestation. I like to disclose this because as a person with disabilities, this is necessary. And you can take a screenshot if you want to grab that. But it looks at, if you're expecting fertility treatment, cancer, diabetes, liver disorders, kidney, HIV, AIDS, lupus, organ transplants, multiple sclerosis, Parkinson's, bipolar, schizophrenia, mental illness, hospitalization, substance dependency within the last 5 years, hospitalized in the past 12 months overnight, and already recommended for surgery or imaging or major treatment, and GLP-1 treatments. GLP-1 is incidentally covered in the base plan as well. But I have to put these out here because as a person who came out of the DEI world, I can't have this hiding and have people shopping and then they come up on this, because when I first found it, it was actually attached to the plans on the top, and I pushed back and said, what is going on? And that was changed. Okay, so what I will tell you is that this is changing all the time. And here's the thing. We've had people who, like we had somebody who had a cancer diagnosis within the last 5 years. And she was in remission, and everything was really well managed. Our people will go to bat for you if you feel like, like I had IBS, and it is incredibly well managed now. And they will actually go to bat for you. And if you have, if you've got your receipts that are just like, look, like, yes, this is something that I've been diagnosed with, but here's what I do, it's going well, like haven't had any issues in a while. And these major medical folks have actually let folks in. So it's not a complete brick wall, but we are working to remove those. Now, I say this now, and take your screenshot if you haven't already, because if anybody owns a business, and if anybody is doing this in their business, the only plans that I'm comfortable selling you into your business, because when you have a business, you can have a platform, and it's like literally zero recurring cost to the business. You can offer these plans to anybody in your business, including like members, volunteers. They don't have to be full-time employees, because this is decentralized healthcare. They can be volunteers, they can be part-time, they can be contractors, they can be vendors, they can be any associates associated with your organization at all. And they can access your portal and access healthcare. Cool thing about this, when they leave, there's no COBRA. We're not punishing you. We're not holding you hostage with healthcare. Rates will be the same. So what we recommend is that if you are an employer, we say it's probably not a bad idea for you to cover like the base plan for people and then let them choose from there. Because if you cover part of it and they leave, they'll have to cover the part that you were covering. Like that's the only change that we would make. Okay. But they can go through your portal. If you do want to cover all of it to subsidize, base plus MVP for everyone, you can do that. This is great for a business of one. This is great for a growing business, because until you hit 50, you're not obligated to do all of the things for people, but why not put the thing in place? There is technically there's like a $295 one-time setup fee for the portal, and that's it. And if you are hardship, ain't got no revenue at all, we can work on waiving that for you if that is necessary. Go ahead, Jana.
Yeah, I'm curious about what you just said. So thinking about the Accounting Alchemy Network, for example, what I'm imagining is Accounting Alchemy Network can have a portal, and the members could get insurance through that portal.
Yes.
So
absolutely.
Communities that come together in different forms and structures can still have something like this as a community, and that doesn't have to be your job or your spouse, right?
No. or your school, right? No.
Yeah.
And because it's more accessible than the ACA, that's exactly why I want to scale this to become, universal healthcare, because it's really great services at really great prices, and it's completely doable. So yes, even if like for instance, the founders of the companies who created some of the early versions of this, they were working with executives at smaller companies. And this is like, I started the nonprofit in 2024, but this program has been running in pilot forms for, like, they're going on the 5th year now. So this has been around for a while. And initially they were doing it with executives and small businesses. And so the model was really built to serve small businesses, entrepreneurs, executives, et cetera. But because of the way that it can be decoupled, I was the first one to raise my hand and say, well, can I sell this to an individual person? Like one gal in California? And they were like, well, I guess. So with the first 3 things, the base plan, the accident insurance, and the hospital indemnity, that anybody can just sign up for that, easy peasy lemon squeezy, because that's not regulated in the same way. It's not the major medical. But as soon as you get down to the bottom half of the page, major medical actually requires an EIN number. So you either have to have a business with an EIN. I have been reminded that an EIN is free, that you can get one, that it's easy, but I'm not trying to create tax nonsense, shenanigans, liabilities for anybody who doesn't want that life. Like for my entrepreneurs, get your own, do the thing. It's awesome. But this is why the community thing works, because if your organization has an EIN, when they sign up through your portal, they can have the major medical, because they're borrowing your EIN. It's already populated. They don't have to know it. It's just in there. And so for individuals who have no association with any portal anywhere, Manifest Equity actually has a portal, and we have created a volunteer association that the volunteer activity that they have to do is tell other people about this opportunity, tell them about the insurance, and they can sign up through our portal. And we've been given permission to do that. It's all on the up and up, right? Because the whole point is to just give people access, right? We just have to give people access. They can afford the premium. Why not? The other thing to let you know is that so for your portal, if you're a business and you're offering it to employees, it is not compliant for you to offer plans that some people can have and some people cannot have. So I personally, other people I hear are doing it, but I personally will not allow you to have a portal if you are offering these to employees that have the plans that have the attestation. So these 3 plans you won't see. You'll see this MVP, the other MVP that's coming on in March, possibly another one in addition, and then all of these. Now, if your organization has 10 or more eligible employees, Cigna and PHCS will customize a plan for you, a plan that everyone in your organization can have. So they'll do a little census situation and do the thing and do the magic that they do. And then your portal can have a customized plan just for your folks. That way we can do it. Otherwise, the membership model is better, because members, volunteers, they don't, those same rules don't apply. They can choose their own adventure. Go ahead, Jana.
So I'm coming back to AAN and thinking about, how can we collectively as a community sort of see the world we want and create the world we want to see. And you said you're a nonprofit. So I could see a situation where members then put money into a community pot that cover insurance for others, so that those of us who have more, right? So is that part of how your nonprofit works?
That is precisely one of the models that's in the works. It's if you get a plan and you sponsor a plan for someone else, because somebody who can afford, a $500 plan or a $700 plan for themselves and their family, probably wouldn't mind subsidizing. It could subsidize. I mean, even if they just subsidize the base plan for other people, that's huge. That's absolutely huge. So we are looking at that as a model as well. Yes.
I'm thinking not necessarily I want to subsidize person 1 and person 2, but I'll put money into
the fund.
organization,
oh yeah,
right?
That's how I'm. Yeah, they wouldn't know who the people are,
Got
right?
It.
And so that's why. So, like for instance, we're aggregating all kinds of different resources for all kinds of different things. This is just one version of what we are currently offering. This is the first one to come online, but we've got more things coming online with Blue Cross Blue Shield and and life insurance, and all kinds of things are coming in this model that allows people to have more access and people to grow their small businesses.
And is your organization a 501c3?
Yes.
All the tax people will be happy with these things.
Yes.
Because it still speaks the current language of taxation.
Yeah. It still does. It does. So one of the things the reason that like you could technically buy these products from other people, and the reason why I say, why should your organization, your nonprofit, your membership association work with Manifest Equity? Because we are building that endowment for the purpose of, I want to make sure that anybody who signs up with our plans, what happens when they do fall on hard times, and even $2 a day is too much. We're trying to make it so that we can cover the gaps for people as well. Like there's so many ways for this, there's so many ways that our system has let us down, and we're trying to plug the holes and create something better. So if we have enough money in that endowment, if people fall and cannot take care of their plans, we'd like to be able to support them so that nobody who's in the Manifest Equity line loses their health insurance because America happens.
Yeah, we should talk offline, because I'm wondering if there are things like, so I go with a base plan and I have an option when I sign up to add $5 to my premium, which goes into this fund, but that's not insurance. That's not my medical care, or does it? Anyway, I'm excited about what is happening.
For a business, that would still potentially be, so that would fall under, because we're a 501c3, you would get a letter for that. So your medical insurance would be fully deductible as a business owner, whether it's yours or your employees, your members, anything that you're paying is going to be a deduction. If you add a donation, so right now we have donation links on the website. If you add a donation to our fund, that is a tax deduction under the 501c3 rules. So that, ladies and gentle friends, is here's the thing I'll tell you. So this counter exists on the bottom of our page. If you buy a plan, sign up for plan before the 15th of any month, your coverage begins on the 1st the following month. So right now we have until March 15th, the Ides of March. It's my mother's birthday. We have until the Ides of March for April 1 coverage. So everybody who signs up, even though this is still February, because it's after the 15th, their coverage isn't going to start until the 1st of the following month. So that's the closest thing to a waiting period we have. We don't have blackout periods. We have 365-day enrollment, open enrollment. You can go in, you can change what you have. If you don't like what you have, you want to level up, you want to level down, you want to add 16 family members, you want to add new employees, that's always open. And this is a little bit about our partners, right? So we've got Benefit Airship is the great aggregator. Amaze Health is the digital program I told you about. Aetna's on dental. 5 Star is providing the indemnity plans for the accident and the hospital. And then Cigna is one of our major medical providers. Down at the bottom of the page, we've got all kinds of questions answered here. You can find doctors, you can find providers, all kinds of stuff. And then if you want to book a call and you want to talk about your own health stuff, if you want to do something personally, you can do that. You can also hit us up at info@manifestequity.org if you want any additional support. And Alina, go ahead.
Yeah, I'm wondering, could you share where to find, like, as part of the base plan, who are the providers? Like, what kind of, where it says virtual, primary, urgent, and specialty, where can I find a list of like what kind?
They don't actually, I've been kicking the tires on this myself as well. And that is one of the things that I don't love, that we don't get to have a menu of providers. But what I can tell you is this. I went on my app. So you're going to, when you sign up for your programs, you're going to get a series of onboarding emails. You're going to get a package in the mail with your card. Even the base plan has a card, and it says, it's got Benefit Airship on it. And it says, this is not insurance, but it's got your RX bin number and all member ID and all the things, right? But you're going to get onboarded with these emails. The Amaze Health app is the one that you're going to go for the therapy. I put in a query, like you can literally ask anything you want about your health, right? I went in and I was just like, I want to talk to a therapist. Someone talk to a therapist. It was 7 o'clock on Saturday night. At 7:05 p.m. on Saturday night, I got a response. And it was the intake, okay, cool. You want to see somebody? What are you looking for? I had an appointment the next day for Sunday at 3 p.m. I had an appointment with and not with the therapist, an appointment with an intake specialist who had a conversation with me about who I am, what I need, where I am. I told him I'm a non-binary person. And so the following 2 days later on the Tuesday, I had an appointment with a queer affirming therapist. The person who did my intake was, you never know, but I think they were a transgender person. And I just was like, my whole entire heart was warmed. It's like not always going to work out that way, but I have asked about things like just various levels of diversity, the things that are going to make people comfortable. They're going to pair you with someone, their intake specialists are going to pair you with somebody that they think is going to be good for you. And the first appointment is going to be a 20-minute vibe check. 20-minute vibe check, not a full appointment, not a commitment to an hour, not an awkward silent video, just like here, do it, does it? And if it doesn't work, they do not take it personally. You'll get assigned somebody else until you have a fit. So while we don't get to have a menu of options, because again, they're covering all time zones. They're all
Yeah,
over the
yeah.
place.
Well, I was just more curious. Thank you for sharing about that.
Yeah.
That's really cool.
Yeah.
That warms my heart too. I was just thinking about like what kind of care. So like I'm thinking for myself, I've been thinking about like a licensed dietitian or something like that. Is that part of the providers? That's what I mean, like categories is more what I meant, not
Yeah.
really like
So
people.
a dietitian is a dietitian is somebody who, so they don't have a dietitian per se in the mental health model. So, and I'll tell you how their mental health model works. It's really cool. But what they would do, part of the healthcare navigation, is that they will help you find somebody in your area or somebody virtual. They will help you find. I realized I needed to go to a rheumatologist. I did not do one iota of research to find that that rheumatologist. They said, okay, what's your zip code? Cool. And in a matter of minutes, they found me the closest, the most compatible with my insurance in terms of what I would have to copay. They will do all that work for you. So it makes it just a huge weight off, a huge sigh of relief that you don't have to navigate your healthcare. I had something where I needed to get some kind of record like scanned in and over to somebody else. And I was freaking out and I was trying to get my partner to go and print it because I'm in the process of moving and downsizing and I don't have my printer anymore. And then I was like, oh, I have a maze. I'm like, a fax. They wanted a fax. I'm like, a fax, really? And I'm like, I don't have my big company anymore. I don't even have my digital fax number. I messaged a maze and I was like, my doctor needs the results from those 15 diagnostics that they sent me to. I was like, could you fax those results to them for me, please? Yeah, no problem. The thing was done in 12 minutes. Right. So with the mental health model, what they do, did anybody ever see the movie Molly's Game? It's a movie called Molly's Game. Okay, Molly's Game is about a skier. She had a horrible accident and she ended up leaving skiing and she became like this poker kingpin. It was wild. I think Kevin Costner plays her dad. They're estranged for a while. They meet up in Central Park and like she's really not trying to deal with him. He's a therapist and he's like, listen, Molly, I'm going to give you 3 years of therapy in 10 minutes. You get 3 questions, one for each year. And so she's like, whatever. So she asks a question and he goes, I'm going to do what everyone wants us to do. I'm going to give you the answer. He gives her the answer. She squirms a little bit and she's like, God, how did you do that, Dad? And this next sentence is why the Amaze mental health model works. He said, it's amazing what you can accomplish when you're not charging by the hour. The Amaze mental health model, like if you know from the pandemic, they were allowed to work across borders. Didn't matter where you were, you could talk to your therapist, right? They relaxed you have to be licensed in the state that the person is in because we were all in a pandemic. They've taken a lot of that away now, okay? The reason that Amaze can do what they do across the borders is because they're not doing standard therapy, talk therapy, whatever therapy. They are doing therapeutic coaching. And here's how it works. Once you do your vibe check and you get paired with your person, you're going in for a discrete issue. There's a reason you went in. We're going to identify why it is that you're here. We're going to create a treatment plan, a plan for you to actually get well, actually manage and handle and hold whatever it is that's going on with you. Because Amaze actually thinks that you can get better. They know that you can get better. So we're going to do what we need to do so that you're on your own and you're feeling better. And then they're going to say, peace. And you're going to go live your life. And if you need to come back 97 times, that's fine. But you're going to come back with a discrete issue. We're going to work on that particular challenge. And we're going to cycle you out until you have to come back in. Because it's amazing what you can do when you're not charging by the hour. They do not need you or want you to be on the hamster wheel of every Tuesday and Thursday for the rest of your life because they're W-2 employees. They're going to give you the best that their training offers. They're going to hold you the safest container. They're going to get you so good and strong that you can get back out there and live your best life with the full reinforcement and confidence and vote and cheerleading of a qualified mental health professional. I've never seen anything like it, y'all. I'm so excited. So that's that. Thank you so much for letting me do this. Yeah, if you have any questions, info@manifestequity.org will get you to our side of the organization. But if you have, we can actually, send you resources. There's a way to sign up for, I think, sales@benefitairship.com. Will get you to somebody who can answer, specific medical questions, specific plan questions. And if you need any presentations, we can hook you up with those, but definitely let them know you came through Manifest Equity. It matters. They know that we're growing big and strong over here and really, really excited to be of service.
Oh, thank you so much. See something in the chat there.
I have not seen that one move through. Again, that's only for the three, that's only for the gold, silver, and the platinum. So that's perfectly fine on the MVP. And then as of March 1st, a new MVP is coming up that's more of a gold level plan. And the way that the MVP works, just so you know, like, how do we have a $260 plan? So what they did was they looked at sort of average typical utilization for a major medical, because sadly, a lot of Americans have major medical and they don't use it because they're scared. They're scared of the bill. They're scared to use it. They don't understand it because they don't have healthcare navigation. And so what happens is what they did is they looked at how people typically use their insurance. And then Kenneth York, the CEO of Benefit Airship, went and negotiated up. And so the MVP has limitations. It's not like infinity use, but it is better than not having any major medical. So it's like 4 x-rays a year, 3 CT scans a year, right? So there's you're like a hypochondriac who has to get every single thing done all the time because they're terrified that they're unwell is not going to do well with the MVP plan. But a person who is managing normal stuff is going to be much more protected with an MVP plan than they are without. And again, if you add the other components in, you add the accident, you add the hospital, if you know that you're managing chronic conditions, for instance, it's great to have those things because it just makes sure that you're not going to go bankrupt behind a medical bill.
Very cool. Does anybody else have any questions that's currently here?
I mean, that's a trick question, right? Like we could stay on for an hour with questions.
So I do information sessions. This recording is probably going to be part of the pipeline at some point. Thank you for recording for us. And then I do information sessions 2 to 3 days a week. And let's see, I think it's my social media. If you go to, right now, it's still on my personal social media. So if you go to @Tiffany Jana on all social media, there's a link in my link tree that will take people to information sessions where they can sign up and decide. They can let me know their situation. They can give me their phone number, their email, whatever, and I will invite them to a session similar to this. And we can do, if somebody wants a private session, right now, I think it's tiffanyjana.com has a private intake session for businesses. And I think it has like a $15 fee just so that people don't block my time and disappear. But if you want to have a one-on-one for your business with me, you can do that. If you do it through the website and press those links at the bottom of the website, you can do it for free with the people who actually administer the plans. So use your resources wisely.
Thank you so much. This was amazing.
So
appreciate you.
I appreciate you too. Thanks for Thanks for being part of the solution. We can't
Yeah.
sit by anymore, can we? Not that we were, but now we just have to
Well, this
we
is
have to
really
ratchet it
exciting.
up a little bit.